Hey there. Tonight we're going to talk about the thoracic spine and how it relates to disc golf. Now, thoracic spine is the middle part of my back, really responsible for rotation and extension. So why is rotation important for a disc golfer? Now we think about in terms of shoulder turn, that shoulder turn rotation to get a nice reach back, that all comes from thoracic spine. If my thoracic spine is stiff, I'm not going to have the best distance potential I possibly could have, and I could be setting myself up for injury having to overuse my neck, my shoulder, and my low back in the process. Now we're going to talk about different ways that we can improve this reach back. We're going to talk about foam rolling. We're going to talk about yoga positions or yoga stretches. And then we're going to talk about some breathing mechanics to help us improve and unlock that thoracic spine rotation comfortably. After you're done improving the mobility, it's really nice to follow that up with some drills to just kind of re-educate the muscles how to improve that turn. So first thing we'll go over is the foam roller. So with the foam roller here, what I'm gonna do is I want to sit against this foam roller where it's comfortable. It's just a little bit below my shoulder blades. I'm going to give myself a hug. I'm gonna make sure my head is in a nice, comfortable position. I'm gonna lift up slightly from the ground, and I'm gonna use my feet to push and pull myself along this foam roller. It's really just gonna address all the muscles between my shoulder blades, and it's gonna start to improve a little bit of mobility in my thoracic spine. Now I give myself a hug to get my shoulder blades out of the way to allow myself to get deeper around those muscles that I want to target. Again, most of my soft tissue work, we're going to do this about 2 minutes to get the maximum benefit. It should never be uncomfortable. If it is, that's a problem. We don't do it. You might get a couple nice little pops and cracks there. Nothing to be alarmed at. It's almost like cracking a knuckle. Again, just make sure it doesn't bother you. Second way we're going to improve that, it's a yoga pose called thread the needle. Now we kind of get on all fours. We're going to take right hand, palm up. I'm going to slowly slide that in this little kind of space right here that my knee and my hand provide. And I'm going to go as far as I can. Now it's okay if this elbow bends a little bit. My goal is not to keep that straight, and I can sit back to my heels a little bit if I feel like I want to. But I'm going to go as far as I feel I can, and I'm going to hold that for a breath. So if you look at this position looks very similar to a reach back position. So I think it's gonna really help unlock like thoracic spine in that sense, where it closely resembles the activity we want to try to improve. I would do this on both sides just to make sure we're not neglecting one side. I might do this 3 to 4 times on each side. Each one I may hold for about 5 or 6 seconds. So next position, we're gonna use some breathing to help unlock my ribs and unlock my spine as well. So I want a pillow. I'm gonna lay down on my side. I'm gonna make sure my knees are bent to about a 90-degree angle. And a lot of times I can either hold this here if I need to. So for the next one, I'm gonna lay down on my side. I'm gonna make sure my knees are bent to a 90-degree angle. That's gonna make sure I do not rotate into my low back, because we don't wanna improve low back rotation. We wanna improve mid-back rotation. I'm gonna put my head comfortably on a pillow, hands on top of each other. I'm gonna slowly turn my shoulders, so I'm going towards the floor this way. I'm gonna actually take this hand and reach underneath my armpit and kind of grab a handful of ribs here. I'm gonna turn until I feel like I cannot turn any further. And again, watch this knee so it doesn't come up. My head can follow and stay right in the middle of my breastbone here. I don't wanna keep my head here and try to turn, because that's not gonna work. So I slowly start to turn, grab onto those ribs, and when I feel like I get to a spot I can no longer turn, I'm gonna take a deep breath. On the exhale, I'm thinking about slowly melting into that direction, but also taking my hand and giving a little bit of an assist and a pull to try to get me to rotate a little bit further this way. And I may try about 3 big breaths to see how far I can get. And then I'm going to do the same thing facing the other direction. After I'm done loosening up on that foam roller, after I'm done doing the thread the needle, and after I'm done doing the open books, I want to start to kind of reintroduce some of that movement that maybe I loosened up that thoracic spine rotation a little bit. I want to have my body use it, and that's going to help it to stick around a little bit longer. So if I go through and I kind of offset my feet, big reach back, and really make sure I get this nice big shoulder turn. So sometimes you might be able to keep that disc here, shoulder turn, extend, big breath, exhale, and return. Reach back, hold, big breath, exhale, and return. Hopefully you can use some of this information to improve a little bit of thoracic spine rotation. Should be able to help our reach back potential and also make sure we can kind of stave off any injuries to our neck, shoulders, and low back. Hopefully that helps you to throw well.